Being addicted to opiates is like chasing a dragon. You're constantly seeking that first high.
Today we're here to watch the documentary Chasing the Dragon, the Life of an Opiate Addict. This was produced by the FBI and DEA to reach our young people, those in high school, our young adults, and even family members, so we can learn more about how opiates, whether it's prescription pain medications or heroin, can affect those that get addicted and their families.
This is our community training, so workshop. What we do is bring the community together to watch the film, and then we process the film after the film screening with a panel. Typically, our panel will include federal partners as well as local law enforcement, local therapists, substance abuse providers, and anyone else that could provide more information regarding the local impact.
I think education is huge, getting the word out to not only our children, but to our friends and family to let them know that this is an ongoing problem. This is something that is going to continue to grow. And unless we work together with law enforcement and community outreach, it's going to be an epidemic that's going to be very hard to fight.
From DOJ's perspective, we have a three-pronged approach. So there's prevention, there's enforcement, and third prong is treatment. There are resources to try to help them overcome addiction, and then once they're trying to be reintegrated into the community, we also have programs and local partners we can work with to, again, help them avoid getting back into the situation they found themselves in the first place.
We actually treat substance abuse as a chronic disease. We keep them on opioid maintenance treatment for about 2 to 5 years. We have been able to taper them off medications, but they continue with counseling. Once again, you have to remember, people can relapse at any point of time. There is help available. I do not hesitate to seek help, and even if you have had failures once in a while, relapse is part of the disease process. It's no reason to get frustrated about it. As long as you keep on, I think, keep at it, it's a disease which you can beat.
We're hoping that they come away with a much better understanding of how powerful and what an impact these drugs can have.
It's scary because they say things that you say, like she said, I'll never touch heroin, and you think that same thing, like I'll never go near that. And so it's kind of like you see people and you're like, wow, that's scary. Or you're surprised, you never thought that would happen.
But knowing that early prevention, talking early, talking often to your children is a way that you can make sure this doesn't happen to your family member. And if you do see some of the warning signs that they are using, knowing where to go in the community for resources so we prevent this early before it gets to the stage of addiction.